This presentation is intended to be delivered to all individuals, but most importantly to those majoring in healthcare, addressing the topic of the goals, activities, and scope of global healthcare agencies in order to help them decide which organization they might be interested in working for. This presentation will analyze and compare the following three global healthcare agencies: the United Nations International Children's Fund, the World Health Organization, and the Centers for Disease Control and Prevention Global Health Initiative. Following the conclusion of this information being delivered to the individual, the hopes are that they will have a better understanding about UNICEF, the World Health Organization, and the CDC's Global Health Initiative so that they can begin to assess where they may like to work in the future that is best for them and their career aspirations. Global Health Organization help bridge the gap between needed and available health resources in some countries because their local or national governments do not have the personnel, financial, or material resources to meet even the most basic health care needs of their population or establish policies to do the same. And what these agencies exactly do. The UNICEF works for a more equitable world by fighting for the rights of its future, the children. UNICEF has been working for children for over 60 years. UNICEF worked to ensure child protection and social inclusion, child survival, education, and emergencies and humanitarian action. The World Health Organization's primary role is to direct and coordinate international health within the United Nations system. The World Health Organization's main areas of work are the following: health systems, promoting health through the life course, non-communicable diseases, communicable diseases, corporate services, preparedness, surveillance, and response, and Centers for Disease Control and Prevention is committed 24/7 to saving lives and protecting people. CDC's guiding principles for laboratory work are to ensure the safety of all staff and the community and be as transparent as possible about their work as they conduct high-quality scientific research to protect people in this country and around the world. CDC has created this laboratory safety site as the portal to keep the public informed of our laboratory safety efforts. So where does UNICEF work? The executive board is made up of 36 member states elected to 3-year terms by the Economic and Social Council with the following regional allocation: Africa, 8 seats, Asia, 7 seats, Eastern Europe, 4 seats, Latin America and Caribbean, 5 seats, and Western Europe and others, 12. The regions are Central and Eastern Europe and the Commonwealth of the Independent States, East Asia and the Pacific, Eastern and Southern Africa, industrialized countries, Latin America and Caribbean, Middle East and North Africa, South Asia, West and Central Africa. UNICEF is not active in the following countries and territories: Bahamas, Brunei, Darussalam, Cyprus, Latvia, Liechtenstein, Malta, Mauritius, Monaco, and Singapore. Facts about UNICEF. There are 17,000 children die every day, mostly from preventable or treatable causes. The birth of nearly 230 million children under age 5 worldwide, about 1 in 3, have never been officially recorded, depriving them of the right to a name and nationality. 2.5 billion people lack access to improved sanitation, including 1 billion who are forced to resort to open defecation for lack of other options. Out of an estimated 35 million people living with HIV, Over 2 million are 10 to 19 years old, and 56% of them are girls. Globally, about one-third of women aged 20 to 24 were child brides. Every 10 minutes, somewhere in the world, an adolescent girl dies as a result of violence. Nearly half of all deaths in children under age 5 are attributable to undernutrition. This translates into unnecessary loss of about 3 million young lives a year. UNICEF supports countries in collecting data related to children and women through multiple indicator cluster surveys, an international household survey program. Since its inception in the mid-1990s, 4 rounds of multiple indicator cluster survey have been completed in 1995 to 1996, from 2000 to 2001, from 2005 to 2006, and from 2009 to 2012, and a 5th is now underway, 2013 to 2015. By 2015, over 280 surveys will have been implemented in more than 100 low and middle income countries. Each round of surveys builds upon the last and offers new indicators to monitor trends and current priorities. The agenda of UNICEF for Every Child in 2015, as world leaders set out a roadmap for human progress over the next 15 years, it is vital that every child is included and that children everywhere are at the heart of a new global agenda. The agenda of UNICEF for Every Child in 2015: to end violence against children, to put ending child poverty at the center of global poverty eradication, to renew the global effort to end preventable child and maternal deaths, to pay more attention to adolescence, the second decade of life, to leverage the data revolution to support the rights of every child, to increase investments in all children, especially the most vulnerable and marginalized, to break the cycle of chronic crisis affecting children, to prioritize education so that all children and adolescents are in school and learning, to stop girls being left out, held back, and pushed aside, and to tackle climate change for the sake of future generations. World Health Organization's priority in the area of health systems is moving towards universal health coverage. World Health Organization works together with policymakers, global health partners, civil society, academia, and the private sector to support countries to develop, implement, and monitor solid national health plans. In addition, World Health Organization supports countries to assure the availability of equitable, integrated, people-centered health services at an affordable price, facilitate access to affordable, safe, and effective health technologies, and to strengthen health information systems and evidence-based policy making. World Health Organization connects countries together to pursue solutions to common challenges. To sustain and expand cooperation, the organization acts as a knowledge broker. It facilitates exchanges among countries, builds capacity, enabling exchanges to be driven primarily by countries themselves. The following areas in which the World Health Organization works. Number 1, non-communicable diseases, including heart disease, stroke, cancer, diabetes, and chronic lung diseases, and mental health conditions, together with violence and injuries, are collectively responsible for more than 70% of all deaths worldwide. Second, promoting good health through the life course cuts across all work done by World Health Organization. It takes into account the need to address environment risks and social determinants of health, as well as gender, equity, and human rights. Third, communicable diseases. World Health Organization is working with countries to increase and sustain access to prevention, treatment and care for HIV, tuberculosis, malaria, and neglected tropical diseases, and to reduce vaccine-preventable diseases. The MDG 6, combat HIV and AIDS, malaria, and other diseases, has driven remarkable progress, but much work remains. Fourth, preparedness, surveillance, and response. During emergencies, the World Health Organization's operational role includes leading and coordinating the health response in support of countries, undertaking risk assessments, identifying priorities, setting strategies, providing critical technical guidance, supplies, and financial resources, as well as monitoring the health situation. One of the things that the World Health Organization did was they were able to support the Philippines during the Haiyan typhoon, and we call this the cooperation among countries. Cooperation among countries can be an effective tool to strengthen, share, and accelerate health development within countries and across regions. Another term is called South-to-South and triangular cooperation. This refers to the exchange of expertise in developing nations. In the health sector, it promotes equitable inter-country and inter-regional development and combats common health sector challenges. The other term is called cooperation among BRICS countries. World Health Organization has adjusted its cooperation in and with BRICS to accommodate the specific needs, priorities, and capacities of these countries. BRICS stands for Brazil, Russia, India, and China. World Health Organization support countries to improve their health outcomes. World Health Organization headquarters is located in Geneva, Switzerland, and there are 6 World Health Organization regions: Washington, D.C., Copenhagen, Cairo, Brazzaville, New Delhi, and Manila, each with a regional office. In addition, World Health Organization has 149 field offices in countries, territories, or areas. Countries without a World Health Organization office are covered by nearby field offices or by appropriate regional office. At the country level, the World Health Organization's relevance lies in supporting member states as they coordinate the efforts of multiple sectors of the government and partners, including bi- and multilaterals, funds and foundations, civil society organizations, and private sector, to attain their health objectives and support their national health policies and strategies. Now let's talk about the Centers for Disease Control and Prevention, or what we call the CDC. The CDC is one of the major operating components of the Department of Health and Human Services. CDC works 24/7 to protect America from health, safety, and security threats, both foreign and in the U.S. Whether diseases started home or abroad, are chronic or acute, curable or preventable, human error or deliberate attack, CDC fights disease and supports communities and citizens to do the same. CDC increases the health security of the nation. As the nation's health protection agency, CDC saves lives, protects people from health threats. To accomplish their mission, CDC conducts critical science and provides health information that protects the nation against expensive, dangerous health threats and responds when these arise. CDC Center, Institute, and offices allow the agency to be more responsive and effective when dealing with public health concerns. Each group implements CDC's response in their areas of expertise, while also providing intra-agency support, resource sharing for cross-cutting issues and specific health threats. CDC's mission is to be a reflection of the population they serve. With over 17,000 employees all over the world, building and sustaining diversity in the workplace is essential. CDC is committed to creating a diverse work environment that fosters appreciation, mutual respect for each and every employee. As their management philosophy says, ensuring diversity helps create a positive work environment where all employees have the opportunity to reach their potential and maximize their contribution to CDC's mission. In addition, this management philosophy encourages CDC employees to demonstrate cultural adeptness in their relationship with CDC constituents and customers. The GHI countries covered by CDC are the following: Bangladesh, Ethiopia, Guatemala, Kenya, Malawi, Mali, Nepal, Rwanda. The global health staff are in more than 342 assignees, 50-plus countries, including more than 40 staff detailed to international organizations who are supported by approximately 1,368 locally employed staff, contract staff, fellows, and hundreds of headquarters staff travel overseas each year to provide temporary technical assistance. Those seeking employment with CDC GHI programs, U.S. government employees are hired through the official job site of the United States federal government. The CDC Global Health Programs typically hire overseas employees at a relatively senior level, GS-13, or its equivalent in Commissioned Corps. Those in a lower level are to consider applying first for domestic positions that will provide qualifying experience. CDC was one of the first health and human services agencies to implement the tobacco-free campus policy. The goal of tobacco-free is to improve the health of its employees by promoting tobacco use cessation. CDC's Office of Minority Health and Health Equity, Diversity, and Inclusion Management leads CDC's diversity effort by focusing its efforts on fostering the development of a strategic framework in support of CDC's diversity policy, which is to ensure that diversity is an integral part of a day-to-day management public health initiatives. Diversity in gender, race, ethnicity, and other unique aspects are what makes this agency richly and wonderfully empowered and capable to do the work of health protection and disease prevention for all people. The paramount objective of GHI, or Global Health Initiative, is to achieve major improvements in health outcomes that are in line with partner government priorities in partnership with multilateral efforts. The CDC's GHI supports the following goals and targets that confirm the United States commitment to the health-related Millennium Development Goals. First, for HIV. Through the President's Emergency Plan for AIDS Relief, or what we call the PEPFAR, CDC supported the prevention of the communicable disease HIV and provided direct support for more than 4 million people on treatment and support care for more than 12 million people, including 5 million orphans and vulnerable children. CDC provides technical leadership and direct assistance to MOH, or the Ministry of Health, and other partners in over 75 PEPFAR-supported countries through its headquarters office in Atlanta, 4 regional offices, and 41 field offices around the world. The regional offices are based in Caribbean, Central America, Central Asia, and Southeast Asia. Malaria. Through the President's Malaria Initiative, or PMI, CDC care for 450 million people with malaria, representing 70% of the at-risk population in Nigeria and the Democratic Republic of Congo. Tuberculosis, or TB. CDC contribute to the treatment of a minimum of 2.6 million new sputum smear-positive TB cases, including multi-drug resistant cases, reduction in TB death, and disease burden. For maternal health, CDC reduced a maternal mortality across assisted countries. For child health, CDC helped reduce under 5 mortality rates. For nutrition, CDC helped reduce child malnutrition across assisted food insecure countries in conjunction with the President's Feed the Future initiative. For family planning, and reproductive health. CDC prevent 54 million unintended pregnancies by providing modern contraceptive assistance and reducing the proportion of women aged 18 to 24 who have their first birth before age 18 via education and birth control access. For neglected tropical diseases, CDC reduced the prevalence of 7 NTDs of the affected population, contributing to the elimination of onchocerciasis in Latin America, the elimination of lymphatic filariasis globally, the elimination of blinding trachoma, and elimination of leprosy. CDC's GHI include global immunization activities primarily focused on children under 5 years of age in developing countries who are at the highest risk for mortality and morbidity from polio, measles, and other vaccine-preventable diseases. For example, cases in Chad, Democratic Republic of Congo, Pakistan, India, Nigeria, Angola, parts of the Russian Federation, and the Uganda-Kenya region. CDC responded to the African measles outbreaks and assessed risks in Malawi, Namibia, Sierra Leone, and Zambia. The Global Health Initiative participated also in Haiti, rebuilding of national immunization program following the 2010 earthquake. The United States Global Health Portfolio includes a diverse set of programs and investments in approximately 80 countries worldwide. All of the countries in which the United States invested are essential partners for achieving and sustaining the ambitious outcomes envisaged in the initiative. So who are these people employed in these agencies or organizations? UNICEF offers a unique opportunity to work for the survival, protection, and development of children and women via dynamic and multicultural work environment in the humanitarian and development field with opportunities for personal and professional growth. According to UNICEF 2014, its mandate is to advocate and promote programs that meet the special needs of women and children. The organization is committed to diversity and inclusion within its workforce and encourages qualified female and male candidates from all national, religious, and ethnic backgrounds, including persons living with disabilities, to apply. Approximately 85% of the organization's posts are located in the field. 7 regional offices and over 150 county offices worldwide, 36 national committees, research center in Florence, a supply division in Copenhagen, offices in Tokyo and Brussels, and headquarters in New York and Geneva. They employ committed professionals to work in the following areas: child survival and development, basic education and gender equality, HIV and AIDS, child protection and policy advocacy and partnership, administration and finance, human resources, information technology, supply and logistics, external relations and communication experts, and for emergency preparedness and response specialists. Moreover, UNICEF's workforce is made up of different categories of staff, reflecting various levels of responsibilities and duties. Each category of staff has its own requirements. All staff must share the organization's values of diversity and inclusion, integrity and commitment, and meet the core employment competencies of communication, working with people, and drive for results. These competencies are behaviors that are used to achieve desired results for UNICEF. International professional staff are recruited internationally and serve in all duty stations globally. They hold leadership, managerial, or specialist functions which require a level of technical expertise. Senior staff or director-level positions are also part of this category. The general service staff are locally recruited and provide administrative and support services across all areas of the organization and in all locations. The national officer staff are nationals of the country in which they perform functions of a technical and professional nature. National officers are recruited locally. The temporary appointments are short-term assignments for various staff roles and functions across the organizations at all levels and categories. The duration of these appointments is typically up to 364 days. Staff members recruited under a temporary appointment modality receive full salary but slightly reduced benefits. All UNICEF staff must be prepared to work in any region or country and to undertake extensive in-country travel. A large part of a typical career is spent in developing countries. On the other hand, the World Health Organization is the directing and coordinating authority for health within the United Nations system and by any measure stands as a testimonial to the vision of global cooperation and international social justice. Currently, it is the acknowledged forum that nations' disparate economic status and divergent ideologies use to reduce and at times even eliminate the nearly abundant worldwide burden of human disease and suffering around the globe. Its constitution was adopted shortly after World War II, sets out the structure and goals of the organization, and its constitution mandates that the organization serves as the UN's directing and coordinating authority for international health work and that it should encourage worldwide technical cooperation in health matters. World Health Organization functions as an intergovernmental agency whose members collaborate for the attainment by all peoples of the highest possible level of health. World Health Organization Constitution also defines health as not merely the absence of disease, but as a state of complete physical, mental, and social well-being. The World Health Organization is responsible for providing leadership on the following: global health matters, shaping the health research agenda, setting norms and standards, articulating evidence-based policy options, providing technical support to countries, and monitoring and assessing health trends. Most recently known for their work surrounding the Ebola outbreak, communicable disease in West Africa, and humanitarian emergencies in many other countries. Health is a shared responsibility involving equitable access to essential care and collective defense against transnational threats. The World Health Organization was created in 1948 to help attain the highest standards of health for all people. The World Health Organization promotes health goals using a three-step process. First, it assesses the health needs of a population. Second, it develops policy initiatives. And third, it implements the policies in targeted region of the world to a limited extent. There are more than 50% of World Health Organization staff work in country offices. Together, they work to achieve the diverse functions of World Health Organization. More than 7,000 people from more than 150 countries work for the organization, 6 regional offices, at the Global Service Center in Malaysia, and at the headquarters in Geneva, Switzerland. World Health Organization multilingual website, publications, and other resources ensure that health information reaches the people who needs it in the languages they can understand. This makes access to health information both more equitable and effective. In line with the mission to provide global leadership in public health, World Health Organization employs health specialists, medical doctors, scientists, epidemiologists, and also people with expertise in administration and finance, information systems, economics, health statistics, as well as emergency preparedness and response. They advise ministries of health on technical issues and provide assistance in scaling up essential prevention, treatment, and care services throughout the health sector. With other players, including United Nations agencies, non-governmental organizations, and affected communities, staff help plan, implement, and monitor programs. Country teams also support advocacy and resource mobilization efforts. Today, the World Health Organization's program range from field as divergent as managerial development and mental health to the prevention and treatment of diseases from alcoholism, which is considered non-communicable disease, to zoonosis, which is considered communicable disease. Targeted health activities exist for many groups, such as rural populations, the environment, women and children, dentistry and cancer patients, and the elderly. All of this just hint at the enormous scope of the organization's activities. This description does not include the programs coordinated with other specialized agencies. For example, the Food and Agricultural Organization or the immunization with the UNICEF or family planning with the United Nations Population Fund. The World Health Organization works via traditional medicine, that it refers to the knowledge, skills, and practices based on the theories, beliefs, and experiences indigenous to different cultures, used in the maintenance of health and in the prevention, diagnosis, improvement, or treatment of physical and mental illness. Such treatments cover a wide variety of therapies and practices which vary from country to country and region to region. Traditional medicine has been used for thousands of years, with great contributions made by practitioners to human health, particularly as primary health care providers at the community level. Since the 1990s, its use has surged in many developed and developing countries. The World Health Organization Traditional Medicine Strategy from 2014 to 2023 was developed and launched in response to the World Health Assembly resolution on traditional medicine, and this strategy aims to support member states in developing proactive policies and implementing action plans that will strengthen the role traditional medicine plays in keeping population healthy. In some countries, it is referred to as alternative or complementary medicine. Employment in CDC. Most CDC global health vacancies fall into one of four positions. First, epidemiologist. Serves as a nationally or internationally recognized expert on critical issues in the field of epidemiology and employs, designs, plans, and initiates epidemiologic studies, surveys, and investigations. Second, public health advisor. Oversees activities involving a broad range of public health programs operating overseas or abroad, and analyzes collected data and findings and interprets complex legislative, regulatory, or policy guidance to develop and implement plans for meeting overseas objectives. Health scientist. Serves as a recognized authority for health programs and conducts research to develop national systems to monitor public health capacity and performance, and the work involves analyzing public health issues and their impact on scientific operations and conducting major statistical studies and projects. Medical officer. Provides medical advice on critical problems in the public health field, and the responsibilities include providing guidance to host governments, health-related organizations, and non-governmental organizations in the development of public health studies, programs, systems, strategies, or services. The United States Public Health Service Commission Corps is a uniform, non-military service with a distinct uniform, insignia, titles, pay, benefits, and retirement protocols that correspond to those of the uniformed military services. The Commission Corps officers are employed in 11 disciplines: dentists, dietitians, engineers, health service officers, nurses, pharmacists, physicians, sanitarians, scientists, therapists, and the veterinarians. Others may apply for any position in the PHS agencies. How to gain experience. For those looking for an opportunity to gain experience in international public health work, and seek a position with CDC's GHI program can consider the following. First, the International Experience and Technical Assistance, or the IETA, training program may be an option. IETA is a professional development technical assistance program that takes place over a 12-month period consisting of attendance at 3 workshops in Atlanta and in Georgia for 3 to 4 days each, and a supervised short-term 12-week minimum overseas or abroad assignment with an international public health program. Second, the Association of Schools and Programs of Public Health offers CDC Allen Rosenfield Global Health Fellowship Program, which provides international training opportunities for recent graduates of ASPPH accredited schools of public health. And this probably may be good for those with masters in public health and in doctoral level. Early career professionals with graduate degrees from ASPPH member schools are also eligible to apply. The CDC Hubert Global Health Fellowship provides an opportunity for 3rd and 4th year medical and veterinary students to gain public health experience in an international setting. The Service Fellowship Program. CDC uses this mechanism overseas when positions are difficult to fill out and there is authorization from the U.S. Embassy in a particular country. The individual programs do their own recruitment and selection for such positions. The following service fellowship program, the first one is the Epidemic Intelligence Service, or EIS, is a 2-year postgraduate training program of service and on-the-job learning for health professionals interested in the practice of applied epidemiology. The Prevention Effectiveness Fellowship, or PEF, is a 2-year highly selective research fellowship for recent doctoral graduates with a background in economics, policy analysis, operations research, decision sciences, or other quantitative areas. The Public Health Informatics Fellowship Program, or PHIFP, is a 2-year applied training fellowship for professionals with a master's or higher degree. They train professionals to apply principles of public health informatics to the practice of public health. The STOP Program, or STOP, to target the date of polio eradication via short-term, highly qualified health professionals can help via the stop transmission of polio teams for 5.5-month non-salaried field assignments, travel, and per diem for food and lodging provided. The last but not the least, the Peace Corps offers a unique experience via health volunteers as a trained physician educator and nurse educators to go overseas to help improve clinical education, expand the base of physician and nursing educators, and build healthcare capacity in countries that face critical shortages of healthcare providers. CDC also has agreements with a number of private companies to provide staff for a variety of global health positions. Employment as a contractor is available through these companies. As a contractor, staff are categorized as an employee of a specific company that has a contract with the CDC, rather than as a federal employee. The terms of employment and benefits are specified by the contractor, not the CDC. So after taking into consideration the information presented in this video, take a minute and think about what organization might be interesting to work for. UNICEF has spent over 60 years working to improve the lives of children and their families, and the organization has career opportunities for aspiring professionals all over the world. UNICEF is working with children to ensure they have the best possible opportunities in life by having access to basic childhood needs such as food, security, shelter, education, protection via child labor practices, and support in war-prone areas. You may want to be part of this organization if you have the passion for helping children and help build a better world for them. The World Health Organization is another powerful organization to consider as it plays a leading role in the prevention and treatment of communicable diseases like HIV or AIDS, Ebola, malaria, polio, and tuberculosis, as well as strategizing programs to help reduce the health, social, and economic burden of communicable diseases in general that are so costly and impact the poorest of those across the globe. In addition, the World Health Organization's commitment to alleviation of the effects of non-communicable diseases to promoting sexual and reproductive health development, working on goals to help prevent and reduce violence and injuries, and mental disorders are all worthy of reflection. For those looking for an opportunity to gain experience in international public health work and may seek a position with CDC's GHI, there are also opportunities to make an impact in health and well-being through this powerful organization. If saving lives and improving the health of those in need via delivering unparalleled life-saving science, groundbreaking medical research, cutting-edge innovation, and proven long-term health investments through the CDC's GHI to create goodwill and good relationships with global neighbors is of interest, then this organization is worth thinking about as well. And while each global organization have their own purpose, vision, and mission, these organizations are interested of employing skilled workers and talented individuals in their respective professions. They all want to reach out to all who have the motivation to serve and have the courage to pursue the global healthcare industry, as well as aspire for personal growth and well-being of the individuals, especially to serve those who are in great need of assistance in the world.